Fox 5 Health News. New SIDS recommendations call for babies to sleep in the same room with their parents for up to a year, but that does not mean the same bed.
Yeah. Joining us now is Fox 5 medical contributor Dr. Devichechi. Good to see you.
Good to see you too.
So this is an important distinction. Not the same bed, but the same room for ideally the first 6 months, but even a year they are recommending.
Exactly. So the idea behind the same room makes sense, right? If the child is having some kind of distress, trouble breathing, something else going on, that at least if the parent is there, that they might be able to sense it. But the reason that it's not the same bed is that, you know, we don't know exactly what causes SIDS. That's what people call it, sudden infant death syndrome. But we think it might be related to some type of suffocation. So maybe because of the soft surface, the soft bed, duvet, comforter, all these different things, that maybe that somehow gets into the baby's sort of nose and mouth, and they can't escape from that. They don't have enough movement to kind of get away from that. Plus, their brain may not be able to adapt as well in terms of their breathing. So the thing about the soft surface, it's not actually just the bed. You want to be careful, even if you have a crib, that you don't have sheets that are too loose that the baby could get tangled in.
And we talked about the bumper last week, no bumpers.
Exactly. So all these different things that might basically cause some trouble for the baby to breathe, those are all concerning factors. Now, to be fair, nobody actually knows what causes SIDS, so it's hard to know. I mean, there is some evidence that for a while the rates actually came down as people got more educated, but they seem to have plateaued, you know, more educated about the condition. So it's important for people to just kind of keep this in mind as well. And even if you fall asleep with the baby, just be careful about the surface that you're on, whether you're in the armchair or not.
So tempting when you're getting no sleep, dealing with a newborn.
Exactly.
Yes, without a doubt. All right, let's talk about this as well. Up to 1/3 of cancer deaths are linked to cigarette smoking. Researchers say that these estimates are probably low because risks like secondhand smoke were not taken into consideration, which is also very frightening because people of all ages are exposed to that.
Sure, and then there's all kinds of other tobacco that we don't think about either, like hookah when people go out. I mean, you know, the quantity of tobacco that's in this, the secondhand smoke, as you mentioned. But even otherwise, I mean, about 1/3 are linked for men and about 1/4 for women in this study. Now, it ranged depending on where you were in the country. So if you were in the South, it tended to be a little bit higher. Now, we think that's probably because for the most part in the South compared to here, some of the laws are a little bit less strict.
It's tobacco country in general,
Exactly. Well, there's more tobacco. The laws about indoor smoking are a little bit less, you know, strict, and also sometimes the taxes are a little bit lower. But we have to be careful. I mean, we say linked to cancer-related deaths, right? But we can't definitely say that smoking causes the cancer-related death because there's so many variables involved in cancer.
You can certainly say it doesn't do you any good, that's for sure. I mean, it's like, this is one thing. The more you learn about smoking, none of it gets better. You know, it's
there's
just
no
like
good news about smokers.
The amount of time you needed to smoke seems to get smaller. The amount of possible repercussions, even for people around it, it's all bad.
And then if you think about it, the only way to actually know for sure how much you know, if cancer or other diseases are linked to smoking is if we do it the same way as a drug trial, right? Where if you have people who don't smoke at all, split them into 2 random groups, and then tell one group they have to smoke, which is completely unethical. So the only way we can tell is after the person has cancer, well, did they smoke in the past, and then how many of those are related. So it makes it really tricky in terms of, you know, telling people that smoking definitively causes cancer, but it's linked to so many different types.
It's been 50 years now we've known it's bad news, that's for sure.
All right. So true.
Yep, Dr. Debbie, we appreciate it.
Thanks. Thank you.